my name's Catherine. I'm here today on the Sally Ann Show and I'm talking about my experience with postnatal depression. I have two beautiful girls who are 11 and 7 and I'm really excited to be here to meet Sally Ann and to talk about postnatal depression today.
So first of all, I'd like to introduce my guest. This is Cath Schrank. She is a mother of two gorgeous girls. So thank you for coming to talk to me today, Cath. How old are your girls for a start?
Natalie's 11 and Olivia's 7.
Okay, so both at school at the moment.
They are.
Yeah.
Yes,
Oh,
yes.
Awesome. So starting a new year this year, that'll be interesting for you.
Yeah. Exciting.
So you're here today to talk about postnatal depression.
Yes.
Now, did you experience postnatal depression after both your children or after the first, or how did that happen?
Yeah, it was just after my first child was born. So Natalie was born first, and when she was born, I went into it thinking that everything was going to be just fantastic and normal, and I always wanted to be a mum. And then probably 6 to 8 weeks in, things started going a bit pear-shaped, and yeah.
So 6 to 8 weeks after she was born?
After she was born, yeah.
So when you say pear-shaped, what do you mean? What happened?
Yeah, so I started getting little symptoms of depression and anxiety. Natalie was a very anxious little girl. She was not sleeping and I wasn't sleeping, and I think our anxiety played off each other, and we both were so connected and so close that maybe that closeness had an effect on me as well. And I think
it's hard, isn't it, because we don't live in communities these days where we actually interact with a lot of children. Had you had much experience with babies before?
No, I hadn't. No.
Because it's hard, isn't it? Because we don't have that closeness. We may not have ever. I know for me, the very first baby that I ever held was my own, and that's sort of weird because you don't know how to deal with it, do you? You don't know how to manage it. So it was something that you were aiming for, you were looking forward to, and all of a sudden the reality, I guess, of the situation happened. So when you said that you had some symptoms of depression, tell me a little bit about that. What were those symptoms, if you can remember?
Yeah, well, I remember it feeling like it was difficult to leave the house, that I didn't want to be social with anybody. I remember that noise became a real issue, so that if there were people in the house, that if there were noises around me, especially when Natalie was going to sleep, that it became very anxiety provoking to me if anybody made any noise in the house. So it had to be quiet. So I didn't like having the television on. I didn't like having the central heating on. I didn't like it if the phone rang. So therefore I started sort of switching off from social things as well. So people, if they tried to call me, I'd usually just ignore the phone or put it onto silent because I didn't like to have the phone ringing. I didn't like to go outside of the house because I felt unsafe.
When you say unsafe, what do you mean?
Yeah, I felt it's a strange feeling going back to that now 11 years ago, but everything felt just sort of strange and weird, and more like I couldn't protect her enough. So even though she was what was actually causing my postnatal depression in a way, not that it was her fault at all.
It was the hormones.
It was the hormones
changes.
and the changes in
your body.
In my body, my lack of sleep and everything. I still felt that I was safe if I was inside my home and if I could control what was happening around me. I didn't like anybody else holding her. I didn't like anybody else trying to feed her or touch her or really bath her or anything. I had to do everything, which again led to more anxiety and more depression for me because it was overwhelming how much I had to do.
And that's the thing, isn't it? I think anyone that's watching this show right now that may, be pregnant or thinking about a pregnancy or have a new, brand new baby, it's interesting to think about how overwhelming and time-consuming it is. From someone who hasn't had children, you think, well, they just sleep most of the time, don't they?
Yeah.
But in fact, there's more of a process, particularly for a new mum. I think for a first-time mum, it's about getting to know yourself and your limitations. And I think everyone goes into it, and probably this would be part of it for you by the sounds of things. You wanted to be perfect. You wanted to protect and do everything right, but we can't do that. And it's hard for us to realise that. So were you getting any sleep during that time, or much sleep?
No, not really, which added to it as well. The lack of sleep was hugely impacting my ability to think clearly, and my emotions were all over the place. My husband, it put a strain on him, and he hadn't seen me like that before, so that affected the way we interacted.
Because you actually said before that you had issues with anyone touching the baby and changing nappies and bathing. Was that including him as well?
Yeah, so he felt a little bit alienated from the whole process, and it made him maybe not bond as easily with Natalie as he could have.
And probably with you too at that point in time. So it's hard to support someone who appears to be shutting you out.
Yes.
And so from his point of view, I imagine that would have been an incredibly challenging time too.
Yeah, it wasn't very nice. Yeah.
So what type of baby was she? Was she colicky? Was she?
Yeah, she had colic, yes. She was a really alert little girl, beautiful little girl. So happy and so funny and really interested in everything, and just a gorgeous bundle of joy who I'd wanted for so long. I'd had a couple of ectopic pregnancies before her, and had tried really hard to get pregnant. So I think this time I wanted everything to work. And
so did that place more pressure on you, do you think, having lost a few pregnancies along the way, and then all of a sudden one successful?
That's right.
So you'd have this pressure of, okay, this one's, I don't know, meant to be, or this one's the my chance now to be a good mum and to do all the right things. And
that's
so
true.
So with the postnatal depression, at what point do you think that you did you recognise that you had it, or did someone tell you, or how did that come about?
Yeah, the maternal health nurse brought it up, and she said that she thought that I had the warning signs of what she thought was postnatal depression, and I sort of laughed it off and thought, no, I don't have postnatal depression. I knew things were tough, but it wasn't until we contacted a sleep school for Natalie, and then the people at the sleep school said that they thought that I needed to be admitted as well, that I realised that I was actually suffering from depression as well. So we were both admitted as patients. Yeah.
And how did that go? What was the outcome of that? Were you there for long, and what happened? What did they do? Was it?
Yeah, it was an incredible experience. Highly recommend anybody going and getting help from a sleep school. We stayed 5 nights there, and we were supported by incredible midwives and psychologists and nurses that helped us every stage of the way, with different things like feeding and overnight. They gave me a night of rest where I didn't actually have to attend to Natalie at all. So I got a full night's sleep, which gave me some clarity for the next day, and that was incredible.
It makes a difference when you actually get a full night's sleep, doesn't it? Particularly when we're sleep deprived, we're dealing with a whole new life, and just to get some sleep is just wonderful.
Yeah, that was amazing. It was really great. They helped me with the little things like routines, feeding, the way that little things that make a difference.
So
it was great.
Yeah. Did they involve your husband at all as well? Was he part of the process, or?
At the time, no, it was really just concentrating on myself and Natalie. So, but then 6 months later, we ended up in another sleep school. So at that time, my husband was included a little bit more in the process then.
So what happened then? What happened 6 months later? Because it sounded like that was so successful.
I know, it was successful, but because she was only 9 weeks old then, I think we needed a top-up of help when she was nearly 8 months old. So we went to a different mother baby unit and stayed again for another 5-night stay. I think we were both, again, just sleep deprived, and it was a tricky first year for us. So,
well, they say that we looked up the statistics, and it's 1 in 7 mums suffer from postnatal depression. So it's a huge statistic.
Yeah.
It's great that maternal health nurses, it sounds like, are looking for that. I remember many years ago they checked me out for that too, and unfortunately I was fine. But it is something that they do look into. Coming up on the Sally Ann Show.
Bang a cup on the bench and I know that she's just been put to sleep. I'll sort of jump or...
So what do you think helped in the end? So you said that you went to sleep school twice. Yes. Was it helpful talking about it, recognising it, getting help? What do you think for you was the biggest thing that helped you through the postnatal depression?
Gosh, I had a really great supportive family. So I was very lucky in that I had help from both families that were hugely supportive of me. My sisters were amazing. Even though at the time I felt like I didn't want the help, and the more people that were around me in some ways made me feel a little bit more useless, if that makes sense. So
yeah, I think what you're saying is that you felt like you should know how to do this, and you should be doing this right, and you should be a good mum, and then all these people are coming in and saying, actually you probably need some help with this or that.
Yeah, I wanted to be able to stand on my own 2 feet and do it by myself, but at the worst time I couldn't be alone with Natalie. I needed somebody to be there with me.
Were you worried about that? Were you worried about either her safety or your safety at that point in time?
Yeah, so still at night when Olivia's now 7, when I put Olivia to bed at night, and if somebody goes to make a cup of tea and the kettle's too loud, or they bang a cup on the bench and I know that she's just been put to sleep, I'll sort of jump, or I'll make eyes at somebody, can you be quiet please, because I still have that feeling of anxiety.
When it comes to noise.
Yeah.
Are you still taking antidepressants?
I am.
And still getting therapy?
I am. Yeah. So all this time later, I'm still going through it, but
and it's great that you acknowledge that. It's great that you're able to talk about it and share your story with other people. That's great, because it's a high percentage of people, and we don't have to be perfect. We don't have to think that being a mum is totally our responsibility. There are support systems, there's support people, whether they're friends, family or professionals, and they're all there ready to help us. Well, thank you very much for coming, Cath. I really appreciated you sharing your story. Thank you so
for having
much.
Me. I've appreciated talking about it.
Thank you.
Thank you.
I'm Kelly Tweedale, and I'm here with Sally Ann to talk about postnatal depression.
Thank you for coming to speak to us, Kelly, about postnatal depression today. Now, you are the mother of whom?
2 boys, Matthew and Ben.
Okay. And how old are they?
4 and 8 in about a week.
Oh, lovely.
So 4 and 8.
Yeah. So you had postnatal depression with both of them?
No, just with Matthew, my second.
Tell us a little bit about that. So how was the pregnancy and the birth? And
the pregnancy was fine. It was actually ironically enough, a much easier pregnancy than with Ben. It was all quite normal. I had difficulty getting pregnant the second time, which I hadn't thought much about it, but may have contributed to it. I had 4 miscarriages in between the pregnancies. But yeah, the birth was quite normal. I was quite happy when he was born. But after probably, I don't remember exactly, 6 to 8 weeks, it was evident that he was going to be quite a difficult baby in regards to sleep, mainly. And I think that is possibly what set it off.
So, all right, so the pregnancy went well enough, the birth, and so the first couple of weeks were okay?
Yeah, fine. I mean, you know, the normal tiredness and everything. To be honest, I don't remember exactly when I started feeling miserable, for want of a better word, but I remember one night just sitting in the living room nursing Matthew, because I always had to nurse him. He wouldn't go to anyone else. And just sitting there kind of staring into space, and my husband said to me, "You look absolutely miserable," and I think I just started crying, and that's when I realised that I'd been quite miserable for a while and was having trouble.
So tell me a little bit about that then. Were you, before your husband said anything to you that night, was there any recognition of things not being quite right? Because you'd had a baby before.
Yeah.
And, you know, was there a moment where you thought, look, I don't feel quite right, or?
I did. I don't think I sort of boxed it into the postnatal depression category, but, you know, I mean, as you know yourself, it's difficult when you have a newborn, you're not getting enough sleep, and obviously being my second, I also had a 3, Ben had just turned 3, so I also had him to run after. And so I guess I wasn't really sure if I was just tired or...
And that's a thing to keep in mind with postnatal depression. For a start, it doesn't have to be your first child. It can be a subsequent child. Yeah. And in addition, as you said, being a busy mum already, and you'd been down this path of, you know, having a baby, having a newborn at home, you probably just got too busy. You knew what you had to do, and you probably got really busy with life and didn't have the opportunity or the space really to stop and take stock of what's going on for you at that point in time, I imagine. Yeah. So this wasn't your first child, and you probably just were so busy with your life, and it's something that you wouldn't have even expected, even if you knew about postnatal depression. Or did you know about postnatal depression?
I did know about it, but, you know, as I said, it's hard to know, I guess, until you experience it, what it is and
what it feels like for you. Yeah. Because, and especially I imagine, I don't know, but I imagine not having it the first time, would you clear yourself of it?
I think so, and I love, well, not love, I was going to say loved. I love being a mum, and I've always been very maternal, and, you know, if I had the money and was a bit younger, you know, I'd have 5 children, but you know, I love having babies, and so I guess part of me maybe was denying, in a bit of denial, because I loved having them around, and I didn't quite understand.
Yeah, what was going on? Because I imagine, as you said, you loved kids and love kids, and to suddenly feel something different must have been quite puzzling. It's great that your husband was, you know, noticing how you looked and said something, you know, and maybe again that's something for husbands and partners and friends to take note of, that we need to say, you know, are you feeling okay? Or, you know, this is what I'm observing. Is this true for you? And in your case, it was you looked miserable. And so he pointed that out to you. And that was great, that acknowledgement by the sounds of things, because you just burst into tears. And
I mean, in hindsight, I was crying all the time. Crying a lot. We'd go out for dinner to my brother's house, and, you know, I couldn't I had to sit away from everyone and nurse Matthew, who was constantly crying, and he wouldn't go to anyone else, and so I just couldn't get any time to myself. I think that's how it all sort of started.
Coming up next.
People possibly don't know exactly what it is or what to look for.
On reflection now, looking back, what would you say that the symptoms were for you?
I think crying, definitely. I'm not saying that's always a symptom, but for me, just being very emotional about everything.
So were you sleeping? I know that the baby was having some difficulty, but were you sleeping in between? Were you able to?
I was able to, but I was also sleeping during the day, just trying to sleep whenever I could.
And what about the thoughts in your head? Because sometimes some people get to the thoughts, which is, you know, where we really need to get help. If this happens to any of you watching this at the moment, if you have the thoughts of, you know, the baby would be better off without me, or, you know, I'm not capable of doing this, or wanting to hurt the baby, and I don't believe that was your experience, I don't think.
No.
But it is an experience that some mums do have, and there's a large percentage of mums that experience postnatal depression. In terms of you, because it's only been a few years since you had your children, did you have any conversations with anyone in hospitals or anywhere with regards to postnatal depression through any of your pregnancies?
I think it's mentioned, but in hindsight, it's probably not spoken about enough. I mean, I think everyone knows the term postnatal depression, but people possibly don't know exactly what it is or what to look for.
Yeah, because I think that there's some confusion sometimes, and for anyone who has just had a baby or is about to have a baby, there is the baby blues that some people refer to, which is the hormonal changes that every mum has after the birth of a child, because, you know, you were growing this gorgeous being inside you, and then all of a sudden your body says, okay, it's time to go out, so it produces some chemicals that allows that to leave, and then it produces other chemicals to allow you to have breast milk regardless of whether you feed them or not. So there's lots of hormonal changes, so it stands to reason that a mum will have some type of blue period after the birth of their child, and I think it's something like 80% of mums that experience that. However, that's not postnatal depression, and I think that, you know, sometimes some mums might think, well, I'm still teary and it's just the baby blues. But if it's going on for a long time, and if it's serious, and if you start having, you know, negative thoughts, or even in your case, as you said, you were just miserable. You had this gorgeous little boy whom you loved dearly, but you couldn't enjoy him. He was just something that at that point in time, it was just something, it sounds like you were just going through the motions.
Yeah, and I think sometimes even postnatal depression can even go the other way. Like sometimes you think sometimes you think postnatal depression should be something really bad, and I guess maybe I felt that I didn't recognise it because, you know, I wasn't staying in bed all day, and I wasn't wanting to harm my baby, and I wasn't wanting to commit suicide, you know, so maybe I just didn't. There's different degrees, I guess, and I think sometimes people only think of it as being really bad.
That's actually an excellent point, really, Kelly, and something I hadn't really thought of with regards to this, because you're right. We hear, you know, when we hear about postnatal depression, we hear of those parents who do want to kill themselves, want to kill their child, want to hurt their child, want to leave their child, won't get out of bed, won't nourish them or feed them. So we do consider that to be postnatal depression, which it, you know, probably is. However, as you said, there's degrees of it. It can be simply, or not simply, but it can be the mum who just can't stop crying and still functions, still.
Yeah, I mean, I was still functioning. I was still taking my youngest to kinder, and I was still cooking dinner and doing all the things I was meant to be doing, I guess. But I just wasn't happy.
So it can be. It does appear to be lots of different, like almost like a spectrum, as you were just saying. For those people that are listening and watching the show now, again, to keep in mind that it can be just those small changes that you might notice. If you're not enjoying your life, and you have every reason to be enjoying your life, then talk to someone, talk to your partner or a parent or child or another mum or another dad or someone, and just start the conversation. And if you don't think then, or if they don't think that you're doing as well as you thought you might have been, it's probably time to speak to your local doctor and have a conversation then. Okay, all right, we might leave it at that. Thank you so much, Kellie, for having the conversation. I really appreciate it.